Perinatal actually covers during as well as after pregnancy. So there are some symptoms of mental health related issues that start before the delivery, but mostly it is about postpartum. So the reason why I have not called it postpartum is kind of taking a look at everything and what you can do before as well as after. So, what happens in the postpartum brain is, for the first thing that happens is while we are pregnant, while we are delivering, so the body kind of loads up on progesterone, loads up on oxytocin, and these hormones essentially make us feel very good about things. Sometimes mislabeled as the love hormone, oxytocin really increases. In fact, that is what triggers the labor, and afterwards it carries on so that you can bond better with the baby. Progesterone, in the meanwhile, which has kept the pregnancy safe, which has kept our mind safe during pregnancy, there is a huge crash. The moment you deliver the placenta, the progesterone goes down to almost zero, and that's when you stop feeling so good. So it is
Mm,
extremely common. Be
yeah.
it absolutely anyone, somebody who has no history of depression in the past also can
Mm,
also feel slightly low and obviously de-energized also, because labor is a very intensive
yes.
uh,
It's
process.
physically draining also.
Absolutely. 100% draining. And let's just hold on. I think we have somebody in the meeting. Yes. So, what actually happens is the progesterone falls down, and the progesterone is actually responsible for a lot of things. So it has a huge function to play during pregnancy, for triggering labor also. But in our minds, it keeps us sane. It is sort of like a very stable hormone. So it keeps your emotions stable, it keeps you feeling good, it keeps you feeling positive. But the moment it goes missing, it is, apart from suddenly the 10,000 new things that you have to be responsible for now, there is also a very, very real biological change happening in our bodies. So that triggers a lot of the postpartum blues that we call. Then, because for a lot of first time mothers specifically, it is the first time that you're responsible for an entire life which you are not carrying inside your body. And there are so many people giving so many suggestions, so many different advices, so many different schools of thoughts. And there is lack of sleep also. There is weird nutrition happening. There's stress about lactation. There is stress about the hospital. Sometimes a lot of babies, which is very common, show certain reactions to something.
Right.
Very commonly, they have jaundice, or high
Correct.
bilirubin.
Correct. Correct.
And all of these things make a lot of difference.
Yeah.
So it all adds up, and it adds to the feeling of helplessness, to the feeling of overwhelm, and to the feeling of not being able to do
Yeah.
something, not
Yeah.
doing enough,
Change the
which
situation.
absolutely, which I think kind of lasts for many, many years, the feeling of not being enough.
I was just about to say, while we are saying postpartum, there's no end limit to that thing, right? Because these can be triggered at any point. At the moment your family or support situation changes, these, are just triggers.
Absolutely. And I think the biggest thing that people kind of forget is, for any female to get back to her prenatal health, prenatal physical condition, it takes around 7 to 8 years. So even for the hormones to settle, it takes around 7 years. So even
Wow.
any postpartum mental health conditions, they are, so sometimes PPD cannot immediately start. It can start 2 years, 3 years down the line. So
Wow.
till up to 5 years postpartum, you can suffer from a postpartum mental health condition.
Okay.
So we need to be very vigilant. Sometimes
Hmm.
people are aware still in the first few months. And after that, things settle down and everybody starts thinking, okay, this is not related to it. But most
Right.
of the things it is.
Right. I think that's a good point, because generally when we talk about PPD, we look at only the first few months after delivery. But, as you said, it can go beyond months or even years. Yeah.
Absolutely. I have had patients who have been suffering from PPD for 4 and 5 years. So they never had a chance to recover because they got the treatment options very late. They realized that it was PPD very late. So I think that awareness needs to increase a little bit.
Right.
And in India, okay, this is just the number that is known. So we have no idea what about the unknown cases. But in India, postpartum blues are as common as 35% in
That's a
the
huge
Indian
number. Yeah.
population.
Yeah.
Second. So, okay, Prachi, I think I will just stick to this because so it'll be easier to
Yeah,
accept.
yeah, it's easier. Right.
So, PMADs, which is postpartum mood and anxiety disorders, remain even after blue should be gone. I think we can hear somebody. Can you mute?
I think Nipun, if you can mute, please.
Yes. So 35% is the percentage of postpartum blues which are considered to be normal. So there is no issue. They resolve by themselves. They do not need any sort of treatment. They do not need any sort of intervention. It is a low mood that is triggered by all the overwhelming happenings around us. And it should be gone in a few weeks or maybe a couple of months' time. But what remains even after you expect the blues to be gone is a disorder. And that needs treatment, that needs care, that needs a diagnosis to actually be able to get proper treatment. So the number of women in India that suffer from, again, like I said, the known number, we have no idea how many unreported cases, is approximately 24%, which is a very, very high number. One out of every four women is suffering
Yeah.
from some postpartum mental health condition, and
Mm.
very few actually get the help that they need. There are a lot of reasons to that. There is obviously societal stigma. There is no real possibility of knowing it till it is too late, till the symptoms have increased. And I will say that postpartum depression is still one of the easier things to deal with compared to a few of the other postpartum mental health disorders. So we'll just move to that. Now, the only known one is postpartum depression, but there is also postpartum anxiety. There are 6 disorders in total. There is postpartum anxiety, there is postpartum psychosis, then we have uh, postpartum bipolar, postpartum OCD, and we also have PTSD, which is post traumatic stress disorder. And
Oh my God. Yeah, that's a big list.
yes, yes. So, unfortunately, because there is no real facility that is available for the diagnosis, unless and until somebody is very educated, very in touch with the field, they have no idea what is happening to them. So, postpartum psychosis, I will personally say it is one of the most scary things to experience. Can be very unreal, and new mother trying to deal with everything might not understand what is happening to her, and it leads to a lot of scary consequences. So just recently, I think a couple of days back, I read in the paper there's some big case that is happening. A mother killed off her 4-year-old and tried to escape. The police caught her. So I don't know what the actual story behind it. I think they're still kind of looking it up. But because it is a 4-year-old, we cannot rule out something like postpartum psychosis. Since it has a window of up to 5 years after birth, we don't know. There could be multiple reasons. We have no idea of knowing, but that is also a possible reason, and it can lead to very devastating consequences. So, early tapping, early diagnosis, early treatment really makes a huge difference in dealing with these disorders. And just increase this. Yeah. So the first, obviously, that everybody knows about is postpartum depression. Now, how to understand if you or somebody that you know has this? Look for these typical signs. There's also a screening test that I will share with everybody at the end of the session. So first, there is anger. Now, anger might not seem like a very typical symptom of depression, but there is anger. There is almost rage, and the most common place that this rage is expressed in is the marriage. So the spouse or immediate family members. If you have other children, older children, they also become kind of like a receiver at the end of this rage. There is anger, intense anger, which cannot really have sufficient triggers. And low mood and energy, obviously, very low energy. Uh, Issues with sleeping. So when I say insomnia, it could be very a lot of sleep or very less sleep also, where you find it difficult to fall asleep even when you're feeling sleepy. When you wake up very frequently, it could be
Hmm.
problems with concentration. So you find it
Yeah.
very, very hard to focus. Now, it is said that when a woman delivers a baby, her brain kind of, the it is not said, it is also proven through research that the gray matter in the brain suddenly increases uh, because you need to be perceptive to a lot of information in the surroundings. You need to learn a lot of different things. So you are actually capable of learning, you're actually capable of concentrating. But if that is not happening, if you cannot take in your information, if you cannot focus on the things that need to get done, then maybe it is a red flag. There is a huge problem with decision making, not being able to make decisions, feeling confused. Now, if this has always been you, that's a different story. But if this is something that is new, then again, and it comes along with other symptoms, then something to watch out for. Then there is also issues with self care. Basic hygiene also suffers. Taking care of yourself, eating properly, sleeping, taking a bath, cleaning, walking, doing some sort of exercise, working, all of these things start suffering. So all forms of self-care that you need to do on a day-to-day basis, they start suffering. Changes in appetite and weight. So it could be suddenly appetite increases. There is again another shade to it, that if you're breastfeeding, it's bound to happen no matter what, but it settles down after a while. So if that is not happening, or if there is a very sudden change in the weight, be it drop or increase, then again it is alarming. And everyday tasks are very difficult to complete. um, then there is an extreme concern and or negative feeling towards the baby. So you cannot, everybody's worried, we've all gone through it, and there is a lot of worry, especially if you're a first time mother. And there are multiple very contradictory suggestions coming from everywhere. So but if you feel that, okay, the amount that I worry, the amount of concern or the amount of vigilance that I'm showing is not normal, then maybe watch out for other symptoms. Sometimes there are also negative feelings towards the baby. So somebody that I worked with had this feeling that, okay, my baby does not love me. It is common to feel that I don't love my baby, I don't want to bond, I cannot handle all of that. There's a lot of guilt, withdrawal. But it is very surprising when the for uh, 2 weeks postpartum, when the baby is absolutely dependent on the mother, to feel that my baby does not like me. So if that is happening, and if there is no real reason to think it, if there is no evidence to that, then maybe look at possibility of postpartum depression or other issues. Then there is also frequent crying, loss of interest in everything that was done prior, or things that were liked well, social withdrawal. This is also natural with, you know, 1 or 2 months postpartum, where you don't want to meet anybody. You want to kind of have space to bond with the baby. But if that is the reason, nothing to worry about. But if you do not also want to bond with the baby, you do not want to socialize with anybody, you do not want to do anything, and it feels very heavy. A lot of times there is something called lead-in paralysis. So your arms and your legs feel very, very heavy, and it is very difficult to move. You feel like lying in bed all the time. So all of these things coming together show us that there is definite signs of postpartum depression. Any
Got it.
questions, anything that anybody has about depression specifically?
I would like to share one thing, as you mentioned, ki it's not always about lack of sleep. Sometimes, like, that is my trait. When I'm too stressed, I just feel like lying down. Like, I just feel like sleeping a lot. So, I think that was a good point because many people relate to stress as lack of sleep, but you should also understand the other side of it.
Oh, yes. In fact, the brain shuts off when you're very, very stressed and you feel overly sleepy and you kind of don't want to stay awake. Your arms and legs start feeling very heavy. I have also had it described to me that I wish I could just take off my arms and legs and keep them separate for a while. It's that heavy. So, feelings like this, there is also sometimes suicidal thoughts. Again, with depression, big red flag. If there are suicidal thoughts even once, it is definitely a cause for concern, and you need to seek help. If it is somebody that you know who has mentioned it to you, a new young mother, take it very, very seriously and make sure that the person gets help, because um, like I said, there is a lot of hormonal shift that is happening. So impulsivity is at a very high level, and there is definite lack of sleep. So nobody gets to sleep full time in the first couple of months. Okay, your sleep patterns definitely change no matter how much help you have. So it is very important to keep a watch as to what the mother is saying. Or if it is you, then what are the thoughts? If you find yourself thinking about suicide even once, you need to seek help. Uh, Moving on. So then there is postpartum anxiety. Now, anxiety is very common otherwise also postpartum, because everything is new. You're worried if I'm doing the right thing, if I'm not doing the right thing. But it is more than just worry. So when there is muscle tension, you will find a lot of times women develop TMJ, which is pain in the jaw area here. So it is caused by muscle tension. A lot of times, physical aches and pains, which are not related to any of the activities that you're doing. So it's not because of sitting for too long. It is not because of holding the baby, but it is because of tensed muscles. Then there is frequent nausea and stomach aches, or some sort of issue with digestion, which is again, see, a lot of these things will be comorbid with actual physical changes happening in the body because of having a baby. So things that you find are not normal, things that people around you are not saying I have experienced, maybe question them, look at them a little deeper. Then there are issues with the heart rate. So it either be too fast, it'll be too slow. If usually the anxiety is too fast, so keep a check on that. Problems with appetite. Again, when I say problems, it could be either ways. Everybody reacts differently to stress. So appetite could be suddenly very much or very low. Problems with sleep. There is this feeling of constant jitteriness. You don't know what to do with you. You're very restless. Then issues with breathing also. Sitting still, it is very difficult to sit still. Like I said, very restless. There is inability to relax, and a lot of racing thoughts and constant thoughts. What if this happens? What if that happens? No break from thoughts, and a lot of forgetfulness. So one of the main thing that happens with anxiety is that you lose your cognitive function. So forgetfulness is a very clear sign of that. And it is also a sign of sleep deprivation. So it's all linked together. But when it comes one after the other, when all the symptoms kind of match, then we can say that it is anxiety. There is irritability, but not necessarily anger and rage. It is just frustrated all the time. You are overcautious, looking at, if somebody calls you, you're suddenly very stunned. You're very quickly surprised in a way.
Yeah.
Then there are irrational fears. What if my baby? So a very common thought is, what if the baby falls down? What if something happens to the baby? Even when you're holding the baby properly, what if I drop the baby out of the balcony or things? What if I throw the baby? So all of these are also very common thoughts which come to a lot of mothers suffering from postpartum anxiety. And sometimes there is obsessive and repetitive behavior, which we will look at in more detail in postpartum OCD, which is another anxiety disorder. And there is over caution, obviously, over caution about everything related to the baby. So, not being comfortable uh, about all the things that are normal for babies that age. And then being extremely worried, reading up too much. One of the counter indications is stop reading online. Anybody who's dealing with any form of anxiety should genuinely stop Googling, because that increases the anxiety. There is also obviously avoidance of people, places, and things. So you kind of want to shut down, uh, cocoon your baby and yourself. But with anxiety, unlike depression, it is commonly, so if you just have postpartum anxiety, it is commonly, it does not happen that there are negative feelings about the baby. It is just a lot of worry more than negativity. And then there is
And
postpartum.
I don't
Yeah.
know, like, this anxiety is something which many of us face so many other times also, right? And sometimes you feel being in the cocoon is helping me recover better. Do
Yes.
you feel that kind of also helps at times?
So very honestly, if it is by choice, it is driven by a very logical, well thought reasoning, then it helps. But if
Hmm.
it is driven by fear, it
Got it.
does not help, because the social withdrawal, in fact, is harming more. If you
Got
mix with people, you will find that, okay, there is no real reason to worry.
it. Right, right, right.
So
Understood.
that does not happen. And okay, this is personally, I feel, the most, it is also the rarest of them all. So, postpartum psychosis, it happens to maybe 1 in 1,000 women, but when it does happen, it is quite scary. If you or anybody you know has experienced even one of these symptoms, you need to come ahead, help them, help yourself. So first is hallucinations. So hallucinations, the most common ones are visual or auditory. For those who do not know what hallucinations are, it is real like experiences of either a visual stimulus, which is you see something that is not there, or an auditory stimulus, you hear voices which are not there. It can be even tactile, which is rare. So you feel things physically, touch wise, you feel things which are not present. So a very common um, visual hallucination could be people kind of surrounding you, coming to you, trying to kill you. Uh, a very common auditory hallucination, especially postpartum psychosis, uh, is voices telling you to harm your baby, or that somebody is going to harm your baby. So there is also delusions, where there is thought that everybody out there is, thinking something about me, saying something about me or my baby. There is a risk of self harm, or there is actual self harm, where self harm being some physical harm to the body, uh, be it cutting, tying, pinching, scratching. It could be absolutely anything, or not eating at all. That is also a form of self harm. Uh, Maybe anorexia like symptoms, bulimia like symptoms, where you eat and throw up. That could also be a form of self harm. And actually trying to harm the baby. So, shaking the baby very violently when you're angry, when you cannot control the anger. Uh, I have read cases about trying to drown the baby. So, these are very um scary things to hear about also, but they are happening to women sometimes who don't want to be doing that. There is a voice inside their head that they have no control over, which tells them to harm the baby. And after it is done, after the voice is gone, uh, there is only guilt. There is intense guilt that is left in the place, because these women do love their babies. It is not that they don't like the baby, it is not that they don't love it. But at the same time, it is very difficult for them to ignore the command that is coming in. So there are intense mood changes. in this, there is also sometimes a very freezing sort of state, catatonia, where you stay in the same position without any sort of movement for hours on end. So the baby might be crying and the mother might just be sitting like that with no real uh, recognition of the fact that the baby is crying. And there is depersonalization, which is not feeling like yourself, or getting an out of body experience where you feel like I'm away from everything. I am just an observer. I'm not actually in my body. There's derealization, again, a very similar experience where you feel out of place. There is irritability and agitation. Just accept. And there is also yeah. So disorganized thinking or behavior, and there is this need. Uh, so you find it very difficult to organize your thoughts, organize or have a clear chain of thoughts. Whenever we are communicating with somebody, one topic leads to another in a very predictable manner. But if suddenly right now I'm talking to you about postpartum psychosis and I tell you, but you know what, last night my dog was barking too. So it has no connection. There is no link to the topic, even in my mind. So if that is something that you observe in a young mother, in a new mother, again, look a little deeper, because disorganized thinking and behavior is a big red flag for postpartum psychosis. So, yes. Moving on to the remaining three postpartum disorders, we have postpartum bipolar, OCD, and PTSD. In bipolar, so it is very similar to normal bipolar. So bipolar means that there are two poles of a mood disorder. So it could be extreme happiness and extreme depression, or it could be a mild level of more than normal happiness and energy and a mild level of depression. So depending on what symptoms are shown, you can, one can be diagnosed either with PP bipolar 1, bipolar 2, or there are various other things. So anybody who has postpartum bipolar has a very high risk of developing psychosis compared to others. So almost 50% more at risk than others. So the thing is that though postpartum depression and postpartum anxiety are the most common, it is possible to have more than just one diagnosis at a time. So somebody can have postpartum depression also, they can have postpartum anxiety also, and they can also have post-traumatic stress disorder altogether, or various combinations of the same. So with bipolar, apart from obviously the postpartum depression symptoms that we have already seen, there is also other symptoms of mania and hypomania. So I will just quickly uh, take everybody through. Um, so there is very high mood and energy with any sort of mania or hypomania, and feelings of grandiosity where you feel that you're somebody very different, special, great. There is a lot of energy and genuinely very low need for sleep. So if you ask me, I get what, 4 or 5 hours of sleep on a regular basis, and I have a 16-month-old. For me, I need more sleep. I just don't get it. But for somebody with bipolar or who's in the mania or hypomania phase, 4 or 5 hours of sleep is a lot of sleep. They don't need that much. They are okay with 3 hours, 4 hours of sleep, depending on obviously person to person. Then a lot of racing thoughts, but not like anxiety. So anxiety also has racing thoughts, but those are worry or fear-based racing thoughts. Here, there are a lot of ideas. Their mind is running faster than their feet, sort of a thing. Lack of concentration, but it is more to do with being distracted constantly than not being able to concentrate because you don't have the energy. There is a lot of energy. So then there is a problem concentrating. Uh, they are compulsively talkative. So you will find that they are non-stop trying to talk something. They don't stop. Anybody you know, okay, that doesn't necessarily just have to be postpartum. So in bipolar, everybody has this forced talkativeness and they are enjoying it, and you end up feeling very energetic when you're with such people. So that is also one of the signs. There is a lot of impulsiveness. Impulsiveness is one of the biggest symptoms more than happiness or energy. Impulsive spending, impulsive decisions, impulsive changes in the physical appearance, impulsive changes in uh, maybe the way they are raising their child. There's a lot of agitation and irritability when things don't go according to their will. So they're very excited. They have a lot of ideas. And when those ideas don't pan out, there's a lot of irritability and not being able to accept any kind of negative response from the outside world. And it can also again trigger a depressive episode. So there are very highs and lows. It is not a constant high, it is not a constant low. It is a cycle that keeps happening, and depending on how often or how intense the cycle is, you I mean the person can be diagnosed accordingly. Then there is postpartum OCD. I have somebody that I've been working with for quite a few years. She had OCD to begin with, which resulted in a very low grade form of psychosis during pregnancy. So she was put on medication. And later on, post delivery, the symptoms abated for a while. So she was doing okay, but the doctor did not want to risk it. So the medicines continued, uh, because of which she couldn't breastfeed. And then the symptoms suddenly increased quite a bit, and the OCD became overpowering. So what is OCD? We've all seen somewhere in pop culture keep washing your hands a lot of times, but OCD is more than that. So persistent, repetitive, intrusive thoughts or mental images that are related to the baby is a very clear diagnosis of postpartum OCD. Now, if somebody has the same symptoms, but they're not really related to the baby, it is still OCD probably, but it is not postpartum OCD. It is not really about the postpartum condition, but they need to receive treatment in any case. So, uh, for an example, something will happen to the baby, something will happen to the baby, something. So, if this is a very constant thought that I am doing any sort of work, but the baby will fall down, something will happen to the baby, I will throw the baby, I will drop the baby. All of these things, if they are very constant, if they are happening without control. So you have no control over it, it is intrusive or getting mental images. Then it is a symptom. There is constant cleaning, checking, frequent counting things to feel better, or reorganizing things that, okay, I need to keep them only certain in a certain way, otherwise things will go wrong. So it is a fear-based response where you need to be organized, otherwise things will go wrong. You need to keep counting because counting makes you feel better, or checking too many times. So if the baby is in another room, normally all of us would check to just see what is happening time to time. But if you feel the need to check every few minutes, when you know that there is no real need to check, then it is a symptom of OCD. Uh, Cleaning of surfaces, cleaning of the baby's body, cleaning of hands, cleaning of feet, cleaning any sort of cleaning when it is a little over the top. Unfortunately, COVID kind of gave a rise to more OCD cases than normal, even postpartum. Then there is hypervigilance about baby's safety and also fear of being left alone with the baby, because then now anything can go wrong and all the intrusive thoughts increase when you're left alone with the baby. So it is a very weird combination of symptoms. But at the same time, there is complete awareness that whatever my obsessions are, whatever I am trying to do to make myself feel better is irrational. So it is not normal, it is not rational, which makes it very easy to diagnose OCD because there is a very clear understanding of it being irrational. Any questions so far?
I think it's very clear.
Okay, I know it's a lot of information in a very small time, but just to
No, I
move
can,
on.
yeah.
So then there is PTSD, again, very, very common. Usually, this was diagnosed only with soldiers or, frontline workers to begin with. But then birth trauma is a very real thing for mothers. Um and a lot of them keep getting flashbacks for somebody who's had a very traumatic birth. Uh, for a normal person, if you ask them right after birth, how was it? They tell you probably a very negative review. It is bad. I don't want to do it again. If you ask them maybe a couple of months down the line, it will be a moderately negative review. A year down the line, they're probably ready to try it once more. If it just about the labor, because the labor was not traumatic enough to remain that. With time, you got over the negative feelings. But for somebody who did not get over the trauma, or who suffers with a post-traumatic stress, there is intrusive, which is again out of your control, suddenly when you're not prepared, re-experiencing of the event. There could be flashbacks or nightmares. When I say event, I mean childbirth probably, or something that happened right after birth. So maybe somebody whose child fell sick and who had to be put in the NICU, or who had a very scary moment with the child. Even if the child is safe now, they keep re-experiencing it. So there are constant flashbacks when you are least expecting it. There are nightmares and avoidance of stimuli associated with the event. So I read about a case recently where a woman remembered some. I mean, she was not diagnosed with PTSD yet, but she was diagnosed with PPD. She was diagnosed with PPA, and she was out shopping in the grocery center, and there is background music playing on a lot of times over the mic. And suddenly the music changed and it triggered her, and she started having intense flashbacks of everything that went wrong during her delivery process. And she had to be carried out of there by her husband. She couldn't manage to walk out. She completely gave up. So a very intense episode of post-traumatic stress disorder due to postpartum post-traumatic stress disorder. Um, so something can suddenly trigger, something can be the stimulus. So she started avoiding grocery shopping. She started avoiding listening to any sort of similar music. Why? Because it triggered the flashbacks with her. Obviously, there is irritability. If you are constantly hammered with thoughts that you don't want to be having, there will be irritability. There is difficulty sleeping, especially if there are nightmares. Hypervigilance, where you cannot relax, where even the smallest of sounds makes you startle. And yes, exaggerated startle response. So every person has a threshold to startle, but when there is out of ordinary startle response, where you call their name also properly, where there is no need for them to be shocked or startled, and they still startle, then it is an exaggerated response. There are frequent panic attacks also, where they find it very difficult to breathe, heart palpitations, a lot of profuse sweating, anxiety, intense anxiety again, and a sense of unreality and detachment, where they don't feel that this has happened, where there is a denial sometimes of the fact that this has happened, where there is difficulty bonding with the child because of that. Then you can diagnose, or you can say, or you can seek help for PTSD. Those are the list of disorders that are diagnosed. But apart from that, even when you have symptoms of any of these, which are not a complete picture, you are definitely dealing with some form of postpartum blues. And I would suggest still go for some sort of help, some sort of support, talk it with somebody. Because if you do not take care of your mental health, it is going to affect all other areas of your life, and obviously parenting. So, is
and
there
also
any?
and also impacting people around you, right? Like,
Absolutely.
yeah.
So that's what actually we are going to look at, that how does any of these disorders, any of these conditions affect other relationships. So the biggest relationship that you have is with your spouse. For somebody who's not married, it would be your partner that you're raising the child with, and in parenting. So, and honestly, the first year postpartum usually complicates the marriage. Very, very few marriages have no changes at all. I mean, no changes to kisi ka bhi nahi hai, but very few marriages actually thrive immediately. It takes a time. It takes a learning curve for everybody to kind of get on the same page and learn to deal with the changes that have occurred in both the individuals and the relationship. So one of the biggest factors that can be a stressor is money, which uh, might not be considered beforehand as a contributing factor to mental health. So if money is not taken care of, because expenses increase exponentially, diapers are so costly. Forget about everything else, and you have to spend. So there is no saying no to a lot of things. You cannot make do without these things. So money can be a cause of a lot of problems in the marriage because it leads to stress, and somebody who is struggling with finances is going to struggle more with other aspects of their life. So there's going to be really less help available, less opportunities. There will be stress of going back to work. All of these things will intensify the risk of getting a postpartum diagnosis. Then patience and rage. So, like I said, a very common symptom of postpartum depression is anger, and that anger is usually directed towards the spouse. So, postpartum rage is if somebody who was initially, before having a baby, a very collected, calm person, and if the amount of times that they got angry was very low compared to how frequently they get angry now, and the amount of fights, the kind of language used during fights, the amount of time it takes to get angry, or it takes for somebody to absolutely lose it, what are the threshold of triggers, all of these things make a difference. So if you find, you, or again I'll repeat, anybody else you know, that the relationship has suffered, is very negative because there is very low patience, and there is intense fighting that is happening, a lot of things, not physical things, emotionally, words being thrown at each other. And for a person who was earlier not like that, then again it is necessary to look at maybe a postpartum depression or something. Then there is a difference in parenting styles, a very, very common issue. A lot of marriages, so uh, previously very healthy marriages end up in divorce within the first year postpartum because of all these reasons. So if you find that there is a problem anywhere in here, even then you need to seek help individually or through a marital therapy session, for the couple. What can be done to kind of resolve difference in parenting styles? Discussing before as well as after, finding time to understand each other's perspective, obviously, and being ready to compromise. So one very common thing in mothers, especially these days, it is completely understandable that you want to raise your child in a specific manner, but same holds true for the spouse. So if both of you are very hell bent on following a very specific way of parenting, which is not in line with the other person's view, then there needs to be compromise in certain areas. So you need to identify the negotiables and the non-negotiables, and then move ahead together after communicating. Otherwise, the child will definitely be affected negatively, but the relationship will also be very strained or break. One of the biggest issues is there is no downtime. So even for people who have other family members living with them, who are living in a joint family, there are other issues. But there is at least some downtime, some break from the baby individually, as well as for I mean, with each other. So the baby is taken care of by somebody else, then you need to find the time. So if no downtime is one of the biggest issues that you are facing, figuring out how to get that time so that you can be a couple instead of just being co-parents to a baby really helps. Uh, Now, sex and intimacy completely goes out of the window. So I've seen so many couples postpartum where the woman feels touched out, especially if she's breastfeeding. She doesn't want to be touched. Any kind of touch can be very overwhelming. So talking about it, communicating about it, understanding, having very clear conversations, and then keeping aside time for some sort of sexual or physical intimacy is very important for the health of the marriage. Again, if there is no interest in it despite even getting time, then maybe again look at postpartum depression or some other issues. I mean, it could be a horde of reasons, but postpartum depression can also lead to no interest in physical intimacy. Then, obviously, no couple time, very, very important. So, we don't have any family. We have a really good nanny, thankfully. And one of my friends stays very close by. Their son is 1 month younger than our daughter. So, we have this deal where we take care of each other's children if anybody else if one of the couples wants to go out. So having people to uh, look after the baby where you can manage to have some time for yourself is very important. And
Yeah,
there
that's a
is a
very good point, Nishigandha, because we all say, there's no village, but, you have to create your own village before even you get into it. So have your support system around, so that you feel supported, even though, you are in a nuclear setup.
absolutely, and it is very important because if you don't feel supported, then you feel lonely. When you feel lonely,
Yeah,
there's going to be biological changes, hormonal
yeah,
changes, which
yeah,
will trigger, which can, I mean, not will, but which can trigger a
yeah,
postpartum episode.
true.
Yes, another issue is both parents, I mean, both the spouses can end up feeling closer to the baby than the partner. And that can actually result in resentment. It can result not towards the baby, but towards each other. That can result in feeling very, very lonely. It can also result in more fights that, now I don't matter. And a withdrawn sort of sense. So, even if the mother has gone through physical aspects of delivery, it is very important to remember that it is both the parents who are dealing with a postpartum time. There are also physiological changes that are happening in fathers that are there, who are present. So, both of you need to be on the same page. There needs to be very, very clear communication. And if at any point of time you feel that, okay, communication is missing, find ways to communicate. One way that I can definitely tell you is if you're on Instagram or if you're not on Instagram, uh, look up Gottman's therapy, and you will find an app that they have. I'm not sure what's the name, but you just Google Gottman therapy app and you will get it. And it will show you a lot of different ideas that you can try to keep your marriage healthy, uh, even postpartum or I mean, without a child as well. And it has some really wonderful reading resources which you can pass to your partner so that you're both on the same page about things that are difficult to communicate verbally. Then, obviously, one of the biggest challenges is unequal division of responsibilities, sometimes even perceived unequal division of responsibilities. So, one thing that I find is very common is I completely agree that both parents need to contribute, especially when you're in nuclear setup and there is not a lot of help. But there also needs to be clear boundaries about what you are willing to do from both the partners. Sometimes, especially if when the mother is on a maternity leave, she has more time to bond with the baby. So it is also very important to let the father get the time to bond with the baby. Uh, Even after both are back to work, try, and if financially possible, I would say try and outsource as many activities that you can, so that the marriage does not suffer because of the number of responsibilities that both of them have. And whatever remains, see what, again, I'll go back to the negotiables and non-negotiables. Whatever is okay with you and whatever is not okay with you, identify that from the very beginning. Discuss it prior to having a baby if possible, but no matter how much you discuss, things will change. So afterwards also, rediscuss it and rework it, and as many things as can be outsourced or automated, Do that so you have more time to spend with each other as a couple as well as a family. Then obviously there is family and friends. And though we love their support, they can get very, very annoying quite often. So I have this very close friend, and every time we're out, okay, my daughter is very close to her. Every time that we go out together and somebody asks a question, can I touch your daughter? Can I pick your daughter? Uh, the person to say yes would be her before I have had a chance to answer. And I have not liked it for a long time, but for some reason, I never communicated it that I wanted her to wait for my response. Or somebody asked the name, that's okay. But when it is about playing with her, touching her, or taking her things, using her things, I want to be the one to decide. So, not communicating was a very bad idea because that behavior continued and it continued quite frequently. So, one fine day I sat her down, I told her that I appreciate how close you are. I appreciate the amount of help because I get a lot of help from her. I appreciate the amount of help that you put in, but I would really like to be the decision maker when it is about her because I worry about certain things and I know certain things that you might not know. And it was taken in quite good spirit. So a lot of times we are worried to communicate because we are not sure how it will be taken, but we won't know how it's taken till we actually communicate. So if you are uncomfortable anywhere with anybody's expectations, with anybody's boundaries, with anybody crossing your boundary, it needs to be communicated. Um, so first is obviously unrealistic expectations from everyone, be it yourself, be it others. You need to realize that they are somebody else's expectations based on their life experiences, based on the kind of help that they got, the kind of help that they did not get, the kind of resources that were available to them or are available to them. And you don't need to complete it because no matter how much we try, so you are at point A and the other person expects you to be at point C. You will try your level best and somehow reach point B. You are not satisfied, they are not satisfied. So if you feel that these expectations are unrealistic for you, then don't try to meet them. Have a conversation about it and tell them that this is where I stand and I cannot move ahead. When there is lack of boundaries, especially with difficult situations, like a lot of times uh, the in-law side of the family can be a difficult place for both partners. So I'm not just saying the woman in this scenario. Both partners can have certain issues with how the boundaries are broken by the in-laws. So one very good idea is whenever you have an issue with the way uh, the in-laws are breaking the boundaries, especially about the baby, be it parenting, be it the way things are said in front of you, in front of the baby, whatever it is, a good idea would be to communicate with your partner and have the partner talk to their family. So if your partner is uncomfortable with how your family tends to do certain things, it is a good idea for you to talk to them. And if you are uncomfortable with how your partner does it, how your partner's family is doing it, it is a good idea for them to talk to the family. But for that, the communication between the spouses needs to be very clear and it needs to be said. So a lot of times we end up saying that, your family does this. Instead of that, a good way to start a response is I get very uncomfortable when, for example, just to go ahead with an example, if you are following baby led weaning and the grandparents feel that no, it is very important you feed the baby, a very common issue that most of us face, because otherwise, the baby is becoming thinner and there is no way that, or they're not putting on as much weight as they should. So you should probably, okay, just a second, we have somebody. You should probably feed them with your hands. Then a good way is to say that, we are trying to raise our child in a specific manner. And when that is contradicted, I feel disrespected or, I feel helpless. And I would like your help in communicating that to your family. Here, you are taking the responsibility. You are not blaming anybody. So it is easier for the other person to accept. It does not sound like an attack, so there is no defense that comes against it. So whenever there is an issue with communication in family or friendships, it is important to talk through a first person lens and talk through an emotional lens more than anything else. It is more acceptable. There are less chances for it to be denied. Another issue is comparison, done by others, done by us. So every time, if you find yourself being comparing your child to somebody else, I will say just stop. Uh, find evidences of why it is. So, if, for example, if it is about a milestone, ask yourself: is there a real reason for me to worry? Is my child behind according to what is the standard norm for this age group? If not, then why am I being worried? And look at yourself instead of the child. If comparison is something that's coming from you, if it is coming from others, put an end to it immediately. Communicate very assertively, very clearly that this is not something that I wish to discuss, because this is my way of doing things and I respect theirs, but I expect you to respect my way as well. There is interference. So that can be a very tricky thing to deal with if you are living with extended family. Anybody here who is living with extended family? Okay, everybody is in a nuclear family setup. That is actually good. But if you are living with extended family, then interference is something that can be very difficult to deal with. Yes. Oh, okay. Um, we would love to hear your experience in trying to set boundaries afterwards whenever we're done with this slide essentially. There is obviously lack of understanding and support sometimes. So, like Prachi said, I think a while ago, creating your own support structures is very, very important. I feel Snugbub offers a very wonderful support. All of us have somebody to quickly ask a question to, and very real research backed or helpful answers, which do not come from a place of Hamare Zamane mein, or a place of things that are no more relevant, because with time people tend to forget all the small details. So somebody who's going through the journey right now, their responses are going to be the most valid. So creating those support systems for yourself. And loneliness can be a very big issue if nobody around you is in the same boat. So again, coming back to the earlier point, creating those support structures is very, very important, and communicating with the necessary members of your social system, be it family, be it friends. If you feel the need that, okay, somebody needs to come here and help me, sharing that. And there is no shame in wanting help. So, also being able to actually ask for help is very important. So, how do you actually take care if you are suffering from, or if somebody else is suffering from a postpartum mental health condition, a perinatal mental health condition? Is first is therapy. It works wonders. It actually lets you uh, understand what you're going through and then resolve it. A lot of times medication, but medication is not the first response, because it can, there are safe medicines, but depending on what you're going through, it can sometimes interfere with your breastfeeding process or some of the other areas of your life. So that is if needed. Medication is not the first response. Therapy is the first response. Self care is an even earlier response. So giving yourself enough sunlight, taking care of your own vitamin levels, get your blood tested regularly. Some of the key things that affect uh, the or have a higher risk of getting postpartum mental disorders is vitamin D3, B12, thyroid, uh, obviously your progesterone. So look at all of these things and make sure that you are on your medication, or you are taking care of your body. You're getting good sleep whenever possible, getting some sort of physical movement. I will not necessarily call it exercise, but there needs to be physical movement. And there is also some sort of social break. There's some me time that you are getting. So self care is the most important, and seeking support.